Time now for Morning Rounds with CBS News contributor Dr. Holly Phillips and pediatrician Dr. Melissa Goldstein. First up, the new push to protect our children from lead exposure. This week, the American Academy of Pediatrics released new recommendations urging action to protect kids from this critical health threat. Holly, first of all, how big is this problem?
You know, this actually is a very significant problem, and in a way, it's a bit of a surprise. It's a surprise because we've spent the last couple of decades kind of celebrating the drop in lead levels in kids. We saw this as a big public health success story, which in fact it was. That drop in lead levels was because of legislation which took lead out of gasoline and, most importantly, out of paint, which was a huge source of exposure for kids. But on the other side of it, continued research has found even very low levels of lead can have permanent effects on kids. So at low levels of exposure, we see behavior problems, we can see problems with attention, lower IQ scores. So really what the American Academy of Pediatrics wants us to know is that the only safe level of lead is 0.
And, you know, I think the Flint water crisis really brought this into the headlines, and people thought old pipes, maybe that's a source. But there are other sources. Holly, you brought up paint. I live in a 100-year-old house. You know, 100 years ago, they weren't worried about lead in your paint.
Well, it's funny because it's interesting because, as Holly just said, there really hasn't been, lead paint is not being used in U.S. homes anymore, and hasn't been since the 1970s, but lead paint still remains the #1 cause of lead exposure to children. Other interesting sources are old toys, toys that have been produced or manufactured abroad where lead regulations are poor. We also find that lead pipes still exist in some old buildings. And we, interestingly, I think this is something that we don't really realize, is that adults in certain occupations and hobbies can actually bring home lead particles on their clothing. So, for example, home remodelers, auto repair shops, stained glass making or pottery. All these are ways that kids can be additionally exposed to lead.
So, Holly, what are some of the suggestions for reducing exposure?
Sure. You know, the American Academy of Pediatrics, they have, you know, a number of ways they want to look at this. Monitoring kids at high risk is really at the top of their list. Those kids would be people who live in areas where 25% or more of the housing was built before 1960. There could still be lead paint or lead pipes, areas where kids can be exposed. The other issue is they want to focus on tightening up federal standards of what's acceptable for lead in our environment. Dust, soil, water, and there's a real focus on lowering lead levels in drinking water and drinking fountains at schools. So they want to try and get rid of it as much as we can.
All right, moving on to something maybe a little more uplifting. Summertime is here, right? The start of the summer is officially in the books. And for many kids, that means one thing, summer camp. But we have some tips for keeping your kids healthy and safe while they are away from home. Melissa, often you think of maybe, you know, a leg breaking, a kid falling out of a tree or something. Yeah. But prevention, what you can do before they go, is important. Vaccines.
Sure, absolutely. I mean, the most important thing is to make sure that your routine vaccines are up to date. And I'm talking about tetanus, measles, mumps, the chicken pox. Those are, you know, routine vaccines. So if you're going for your checkups, your pediatrician is probably making sure you have those. Yeah. But one vaccine that I think that gets overlooked a bit is the meningitis vaccine or the meningococcal vaccine. So meningococcal bacteria, also known as Neisseria meningitidis, is a bad bacteria. It can affect the brain, it can affect the blood and the spinal cord, and it can be potentially fatal. The good news is that we do have a vaccine for this, and that vaccine covers the most common strains of this meningitis bacteria. The vaccine is routinely recommended for children 11 to 18 years old. So that's great. The problem is that there are also recommendations for kids that are over 2 and are at risk. Yep. Well, what does at risk mean? So at risk can mean anyone who's living in close quarters. So the military would be an example, college dorms is an example, and the sleepaway camp cabin, exactly. So if your child is less than 11 but going to sleepaway camp, and many children nowadays are starting sleepaway camp younger, 7 years old, 8 years old, you want to make sure that they get this shot before they start their summer activities.
Right. One reason I hated summer camp, bug bites. So what are the keys to keeping the bugs away, Holly?
Sure. I mean, we have to keep in mind both mosquitoes and ticks can transmit the same dangerous illnesses to kids as they can to adults. The most effective way to prevent bites is to cover up, right? Long sleeves, long pants, especially at dusk or if you're going into, you know, the wooded areas. Also, tuck the pants into socks. My 7-year-old may never forgive me for doing this to her since it's so unfashionable, but that's important as well. And then remember, bug spray with DEET, 20% DEET, is safe and effective in kids. There are other bug spray options out there, but they're probably not effective against ticks and against many mosquitoes. So the bug spray with DEET is fine. You can spray it on their clothes. If you want to put it on their skin, rub it on your hands first and then put it on them and try and avoid getting it in their mouths.
I think I remember the line was, leaves of 3, leave it be, right? Once I learned that, I was totally paranoid about every leaf looked like it had E3 on it. But that, that's a little line that they give you about poison ivy, right? Sure. That's what you should avoid. Is that still a good rule of thumb?
I think in some cases it is a good pearl, but it's really only true for poison ivy and poison oak. Those do tend to have 3 leaves on a short stem. However, poison sumac, which is also a problematic plant, tends to have leaves in clusters of 7 to 13. So that's not going to be a terribly useful phrase
unless you're
for
a botanist.
Unless,
just
exactly.
leave it all be.
Yeah, exactly. Unless you're really great at identifying, I would just leave unfamiliar, questionable outdoor plants be.
All right, Dr. Holly Phillips, Dr. Melissa Goldstein, thank you both for being with us.
Thanks for having us.